So it's time to talk about BII, or breast implant illness. Now, I referred to another post that I've been seeing more women coming to me in my practice to remove their implants. And so, what is breast implant illness? Well, it's definitely a controversial subject in plastic surgery. So, it's basically a constellation of symptoms that could be both physical or psychological and could be attributed to the breast implants. Now, it's not an official medical diagnosis. However, there are plenty of women that are experiencing these symptoms over and over again. And I want to kind of talk about some of the myths and some of the realities of this condition. So, number one, it's not just from silicone implants. It could be saline or silicone implants. But what are the real causes of breast implant illness? Well, it could, again, a lot of this is still being investigated with studies, and so we don't have definitive answers. But some of the hypotheses are that it could be an immune response to the breast implants. It could be an inflammatory response to the breast implants. It could be a biofilm that builds on the implants that harbors bacteria that can have a reaction. Sometimes it could be a genetic predisposition that some women have as a result of having implants placed. But then there's a constellation of symptoms. And so what are those symptoms? Well, some of the physical symptoms could be pain. It could be chronic fatigue. It could be a lot of just joint pain, not just pain in the chest, but a lot of joint pain and discomfort. But it could also be other psychological things like anxiety and depression. And so what do you do if you feel like you fall under that category of symptoms? Well, I would see your doctor, but really the only way to truly find out if it's the implants causing it is to have them removed. There's no diagnostic test to test for whether you have it or not. There's no blood test. There's no X-ray or CAT scan. You just have to have them removed. And when would you know if you've experienced an improvement? Well, it could be as little as a week or so, but up to a few months. But if you still have your symptoms months and months after the implants were removed, chances are it was not the implants that were causing it. So it's a lot to unpack in a small post, but hopefully that gave you a little bit of a primer on breast implant illness.